The next speaker is, I know most of you know her, but probably in the near future, all of you will know her. It's Victoria Rey from Spain. She's a master in the treatment of fibroid by radiofrequency. So the stage is yours, please.
Thank you, Luis, for your presentation. Good afternoon, everyone. First of all, I would like to thank to the organizer, three of you, for inviting me to this roundtable discussion. It's an honor to me to join these prestigious colleagues. And congratulations for the very interesting program, all the arrangements and the exitus, not the exitus, sorry, the success of the Congress, sorry. So maybe, although most of you know what radiofrequency is, we'll start to describe it briefly. And secondly, we talk about what can we expect of this technique. Thirdly, we'll see which type of myoma is indicated to be treated by this technique. And next, what happened with the patient who wished to become pregnancy. We'll briefly mention to the application of the adenomyosis in the application of the radiofrequency in adenomyosis, and finally we will conclude. So what is radiofrequency? Radiofrequency application is use the high frequency alternating electrical current to generate thermal energy, leading the coagulative necrosis of the tissue. This effect was described first time in 1892 by Darsombal, and 100 years later, was used, the radiofrequency was used by Rosenthal in 1992 to treat a bone tumor. To treat the myoma was described, the VRey method was developed in 2018 in Seville, and when treating the myoma, the energy is delivered through an 35 centimeters long electrode, which is positioned into the myoma through under vaginal ultrasound guide. The ablation, the necrosis of the tissue, is produced around the tip of the electrode. Each ablation is 1 cubic centimeter of the volume, and the sum of all of the ablation, which is carried out by fan shapes, line, and section of ablation, will end with the entire necrosis of the myoma. This leads the cessation of the activity of the myoma and the progressive volume reduction of the myoma, because the immune system will eliminate all of the necrotic tissue. You can see what we can see in the ultrasound during the performing the radiofrequency. You can see this white line in the right part of the screen. The ultrasound, this white line is the electrode, and the whitish area is the ablation. The whitish color is due to the carbonic anhydride eliminated by the necrotic cells. You can see how the electrode is white drawn now in order to do another ablation in line. So we need a different line of ablation, and every line of ablation has a different ablation area. In the left of the screen, you can see the screen of the generator. You can check the power and the impedance of the tissue. The power is needed, is calculated in automatic way by the generator, depend on impedance of the tissue. You can see how all of the myoma is treated, which is all of that is white. The white color is because the gas of the anhydric carbonic after the necrosis of the tissue. So maybe this is the one of the best work. This is by Linda Bradley. This is the best work illustrating the outcome of the radiofrequency. We have known that the transvaginal radiofrequency ablation takes an average of 24 minutes. The technique can be performed by under sedation, even the local anesthesia. The patient is discharged in 2 to 3 hours after procedure, and the average time to return normal activity is 2 days. Therefore, the transvaginal radiofrequency ablation is a minimal invasive technique to treat the myoma. Can we expect after procedure the volume reduction is 65% 1 year later the procedure? The reduction is bigger when the smaller the initial volume of the myoma is and the of the patient, especially when the initial volume is less than 100 cubic centimeters and the age of the patient is more than 40. But the most expected outcome after transvaginal radiofrequency ablation is the reduction of the bleeding. We can expect a clearly improve of the bleeding shortly after procedure in 80–90% of the patients, 2 to 3 months later, because the bleeding is independent on the size. So this is one time in the life, the size is not important for these symptoms. The bleeding improve before the volume of the myoma starting reduction. We can expect a very low complication rate from 0.1% for the serious complication, like perforated hollow viscera, 2 to 8% for the mild complication, like dysmenorrhea, urine infection, post-necrotic syndrome, or bleeding, or myoma-free in cavity we'll see later. The recurrence rate is very low, it's lower than the other minimal invasive technique, and we can find in 11% of the cases the patient needs another procedure within the 2 years later radiofrequency. And all of the works have reported and clearly improved of quality of life. I would like to draw your attention in this slide because maybe it summarizes the entire presentation. This is what we can expect if the technique is well indicated and well performed, because the method is very important to the successful of procedure. This is what happened 1 year after the treatment, the transvaginal radiofrequency ablation of this type 3 myoma. You can see in the left ultrasound. The woman hasn't not further bleeding, and the myoma you can see in the right ultrasound is unnoticeable. It's very interesting to know too. One evolution of the myoma we can expect is the necrosis of the tissue dissect the pseudocapsule, and the myoma can be fall free into the cavity, make it very easy to be performed, to be removable by hysteroscopy. So this is especially occur in type 3 deforming cavity and type 2 fibroids with a high component, the intramural component. We can expect this evolution of the fibroid in 11–12% of the cases. So this is the myoma most suited to be treated by radiofrequency. There are intramural fibroid, and the transvaginal radiofrequency ablation will avoid the surgical aggression of the surgery and the scar, especially in women who want to become pregnant or women who has more than one fibroid. So the transvaginal radiofrequency ablation is most suitable for type 3, type 4, and type 5 fibroid. Nonetheless, any myoma accessible by vaginal ultrasound can be treated by this technique. Depend on the purpose. Certain situations will make the transvaginal radiofrequency ablation the best option combined or prior the hysteroscopy in order to solve the myoma in a single procedure or in two different time. For example, the large type 01 myoma with a heavy bleeding too. So the transvaginal radiofrequency ablation will decrease the vascularization, the volume, the consistency, the bleeding, and make it will facilitate the removal by hysteroscopy. The large and with a high intramural component type 2, in this case, is hysteroscopy and transvaginal radiofrequency ablation combined will make the procedure with success in a single procedure. Cases with submucous myoma with a significant cervical stenosis doesn't allow the surgical access to the uterine cavity. The transvaginal radiofrequency ablation can be a good option to treat this type of myoma, especially in older women. So when you have multiple fibros, the radiofrequency ablation can be performed along with other type of technique like laparoscopic myomectomy or hysteroscopic myomectomy in order to solve all of the fibroid in the single procedure, avoiding the multiple scar in the uterus. So what about the patients with a genetic desire? So the main concern of the radiofrequency has been, until now, have been the effect of the energy on the endometrium. So the normal menstruation after radiofrequency and the isolated pregnancy reported after procedure doesn't seems not affect in the endometrium. So it's a logic because we have known the pseudocapsule is the limit of the head spread. And a good, the right method in the performing radiofrequency and the pseudocapsule preserve the myometrium and the endometrium around. So we have known several pregnancies after radiofrequency. I'm happy to present our recently published work about 226 pregnancy after transvaginal radiofrequency ablation. We have reported not major complication, no uterine rupture, no fetal growth retardation, and no fetal hemorrhage. We saw the average time to pregnancy from radiofrequency was 9.4 months. The pregnancy, the C-section and preterm and miscarriage rate was normal, similar to the average population. So the radiofrequency appears, the transvaginal radiofrequency ablation of the myoma appears safe for pregnancy after procedure. We saw a smaller or bigger the volume, the initial volume, the myoma is, longer time to pregnancy. And likewise, shorter the time from radiofrequency to gestation, higher miscarriage rates were found. So the pregnancy could be not early than 6 months after radiofrequency is more safe. I briefly mentioned the application of the radiofrequency in adenomyosis. You can see in the screen how 8 months later the application of the radiofrequency in adenomyosis, this focal adenomyosis, 8 months later, this is the volume is smaller, and the distance from the adenomyosis to the endometrium is higher. This patient improved the symptoms a lot, and the volume reduction has been reported is 60% of the volume 1 year after radiofrequency. So the symptoms improve in a short time because most of the time, 1 year after, the pain and the bleeding is recurrence. The pregnancy rate after the treatment of the adenomyosis by transvaginal radiofrequency ablation is 70%, and especially when the radiofrequency is combined with analogous, and the pregnancy rate reported after radiofrequency adding analogous is higher in comparison with surgery. So what can we take away? So the transvaginal radiofrequency ablation is a minimally invasive technique for myoma treatment because we doesn't need any general anesthesia. It doesn't leave a scar. We have a quick recovery of the symptoms with a low complication rate and recurrent rate. We can expect a quick improvement of the symptoms. The type 3-5 myomas we have known are the most suitable for transvaginal radiofrequency ablation, can be performed along with the other surgical technique in the same procedure, and appears to be safe for pregnancy. So if you need to read some more for this topic, you have the book in Spanish, in English, and something you can to ask me, you can send me a mail. So thank you so much for your attention.